signs that you are a very fertile woman or girl, even if you're not ready to conceive, even if you're not ready to get pregnant. Just know that you are very fertile. With these signs I'm going to mention, no say if you know they're ready to get belle, shift from the man, no, or better still you use your protect. Number one sign is what? Regular menses. This kind of women, their menses is always regular. Even if the menses wants to, shift small, either plus or minus, their menses is always regular. They can tell you when they are going to see their menses, and that is the day the menses will come. Number two, we're talking about is fertile cervical mucus. They are always having this fertile cervical mucus, especially during their fertile window. Number three, we're talking about increased knacking. To knack go the hungry that woman during ovulation time. You see, during that period, to knack with the hungry. It's not your fault, though. You're not promiscuous. It's just a sign that you are a very fertile lady. Number four, we are talking about what? Mini spotting. During this time, this woman can be spotting during ovulation, and some of you will be thinking that something is wrong with you. Nothing is wrong with you. Some women used to have what is known as what? Mini spotting. Is about 20% of women, but not all ladies, you see. And then last but not the least, we are talking about what? Your medicine mesh, which is what? Your ovulation pain. Most women during their ovulation, they used to have what is known as what? Ovulation pain. And it's a very good sign that that woman is very, very fertile. So check yourself. Are you fertile? Thank you and have a blessed day. Bye. Now, I talked about some vitamins that most women need if you know you want to conceive. Now, if you've not watched the video, please go to my previous video and then watch that, okay? Now, today, let me tell you some vitamins that you need if you know you want to conceive, because a lot of women actually lack vitamins, and that's why you'll be having all the symptoms of pregnancy, but you're still not pregnant, you see. And one of them is what? Vitamin B9, which is what? Your folic acid. Number two, your vitamin D3. If you're getting the vitamin D3, please get the 5000 IU. Number three, we are talking about your omega-3 fatty acid. Very, very important. And number four, get your vitamin E, including your vitamin C. These vitamins are very essential if you know you want to conceive. Please go and get it so that you stop having all the symptoms of pregnancy, and at the end of the day, you are not pregnant. And also try to check your progesterone level. Very, very important. Thank you. I still remain your one and only celebrating ancestor. Bye. If you know you want to have a male child, please come closer. This video is for you. Now, women who are struggling to have a male child, this is what you should do. First of all, you must make sure that your menses is regular. That's the number one rule. If your menses is not regular, you're going to mess it up. Or you are having a variation and the variation in your menses is long, you're going to mess this up. First of all, you must have a regular cycle, and you are very good in tracking, which means you're very good in calculating your cycle and good in tracking. So the next thing is, you're supposed to meet your partner, or you should be meeting your partner on the peak day of your ovulation. Please don't meet your partner 3 or 4 days to your ovulation. A day to your ovulation, or on the peak day of your ovulation. And once you meet your partner, you stop knacking for that moment. You understand me? This is the best way you can achieve a male child. Don't forget, the man has the X and Y chromosome, and we as female, we only have the X chromosome. You see, it is whatever your partner gives to you, that is what you're taking. But you can actually help this man by doing gender selection, which means you know your cycle and you know the right time to do your knacking. Do you understand me? So the Y chromosome can survive for 3 days, while the S chromosome can survive for 5 days. You see, so the reason why we say a day to the peak day of the ovulation, so that once the special eugot goes in and the egg will be released, fertilization will take place, which means the Y chromosome will quickly fertilize the egg and it becomes a male child. Please make sure you know your cycle before doing this, okay? If you don't have a regular cycle, don't do this. You're going to mess it up. Thank you and have a blessed day. I still remain your one and only celebrating ancestor. Bye.